people here for requests as to how we deal with seizures. As we all know, we have seizures here, and sometimes we're a little alarmed and don't respond the way we should. So they have been happy enough to send Martha here with us, and she's going to show us a film and talk to us, and she also has some nice material here that she's going to pass out.
Yeah, let me just explain that the film shows simulations of what the 3 most common types of seizures look like, and also gives instructions for what to do or what not to do if you would see a person have this type of seizure. And it's an example of a young man in a restaurant, a little girl in a school setting, and a woman in an industrial setting at work in a factory. Now, this type of seizure is not particular to those kinds of people. An adult can have the kind of seizure that the little girl has and so forth. But these are examples. They do give instructions for first aid. Then I have some material that I prepared previously about the fact that epilepsy, and let me clear up something before we go any further, epilepsy and seizure disorder is the same thing. There's often a lot of confusion and question about that. But epilepsy is simply a person who is diagnosed as having epilepsy if they've had more than 2 seizures and have a likelihood of having more seizures. And seizure disorder is a term that's more often used these days by a lot of doctors. In that this is considered a developmental disability, in that if a person starts to have seizures as a child, before adulthood, that having the seizures, even when it's medically controlled, even when the treatment is effective, and these days up to 80% of the people who are treated for epilepsy get total control of the seizures themselves, at least most of the time. But even so, there are secondary effects, and that's what our agency exists to deal with. We're not a medical agency, we're a social service agency. We deal with the psychosocial effects of epilepsy, the effects of people, how they feel about themselves, how they get along with other people, their relationships, their ability to work, those kinds of effects of a seizure disorder these days can be more trouble and more important for a person than the seizures themselves, because medical treatment these days is so effective. So I'm going to be referring to some developmental theories and how it might affect a person depending on how old they were and so forth after we see the film. And again, I'm a social worker, so I can't answer medical questions about seizures. So I've worked with a number of people. I'm familiar with many of the symptoms. But let's, is there someone here who's ready to show the film? Let's have to start it. So why don't I let you see this example first.
With epilepsy. We may never know who they are, because millions of people live with some form of this disorder and still lead normal lives. Most epileptic seizures can be controlled or prevented with medication. Most, but not all. For some people with epilepsy, the control is not complete, and an occasional seizure may still occur, anytime, any place, without warning. Then it's important to the person with epilepsy that someone there on the scene recognizes what is happening and knows what to do.
Hey, Tony. What happened? I don't know. Help me get him down to the floor. You're cutting my jacket? What's that so for? I think maybe we better call an ambulance. Has he had seizures before? If he has, I never knew about it. You want to move that chair back? Folks, can you move back just a little bit? We'll have to clear this area. Just keep some air there.
Don't you think you put something in his mouth?
No. If we do that, he might break his teeth on whatever we put in there. There, I think he's going to be all right. Now, if you want to grab his arm and his knee there and help roll him up on his side here, we'll make sure that he's breathing okay. There we go. We keep his air passage clear. I think it's just about over now. Heck yeah. Yes, he does have a tag on a medical alert. Yeah, it says he has epilepsy.
I never knew.
Well, he'll be all right. We did what we should have. We got him down on the floor where he won't fall and hurt himself. We're making sure that he's breathing okay. That's the main thing. Yeah. A seizure like this just has to run its course.
The immediate first aid for a tonic-clonic seizure. Protect the person from injury by getting them down on the floor. Place something soft under the head. Don't put anything in their mouth. And turn the person on their side to make sure they can breathe properly. Usually the seizure is over by the time an ambulance arrives. It's still important to call for help unless someone with the person has had experience with their seizures. The emergency medical team will evaluate the person's condition, attend any injuries, and check for any after effects that might be a problem.
He got a seizure, I guess.
He has a tag on. It says he has epilepsy. Did you let him fall?
We helped him out of the booth.
Can you get his head?
No.
What did he look like?
Yeah. Tony.
You know what it looked like?
You know his address? 1644 South 11th Street.
Did you take your medication?
I don't know.
Okay, how well do you know? You know his medical?
No.
You know his medical history at all? Any diabetic problems, seizures, anything you're aware of?
Nothing that I know of, no.
Okay. Tell me what you saw, what happened here.
Well, we were eating and he just started to stiffen up and shake.
Did he start shaking on any particular side, anywhere is more than another, or describe it a little bit?
Well, I guess on his left side.
130 over 50 on blood pressure.
And pulse is 120 on regular.
Did he hurt himself at all? You know, he looked like he hurt himself at all?
No.
What's his name?
Tony.
Tony. Tony, how you doing? Can you hear me?
Yeah.
You okay?
Yeah, I'm okay now.
You know what happened to you?
I guess I had a seizure.
Have you had seizures before?
Do you hurt anywhere? No.
Are you taking medications at all for these seizures? You know what type of medication you're on?
Yeah, Dilan. How's your mouth? Did you bite your tongue?
Yeah.
No, you did. He's diaphoretic.
I know your doctor's name, Tony?
Dr. Munson. Somebody better, Tony?
Diagnosed as having epilepsy and is under treatment, taking them to a hospital may not be necessary. Following the seizure, there is often a period of time known as the post-ictal state, when the person is confused or disoriented.
132 over 60. Regular. Yeah, I'm okay now.
No weakness?
But after a while, if they seem to have recovered and someone is there to be responsible for them, the person can usually be released at the location. The medical team may require them to sign a release to take responsibility for the decision not to go to a hospital.
We're going to have you sign this report. All it states is that we offer you treatment and transportation and you refuse. Sure.
Post-ictal state. A what? A post-ictal state, which could mean he's confused and disoriented. In that case, they probably would insist on taking him to the hospital. But if they're sure that he's functioning normally again, they might decide it's not necessary. How do you know so much about this? About a year ago, we found out that Kathy has epilepsy.
epilepsy? She had seizures like these? Not like these, but she was having seizures. We don't know how long it had been going on. Her third grade teacher discovered it in school.
Aaron, would you read the next paragraph, please?
Feels like the zookeeper explained, but sometimes we can get them to do tricks. Tigers don't have to do a trick. They just sit and eat the raw meat.
Notice, boys and girls, the quote marks around the sentence where someone's talking. All right, Kathy, would you go on reading, please?
Seattle flag to dance.
Kathy? You're in the wrong place. Would you try to pay better attention next time?
Absence or petit mal seizures are subtle and may go unnoticed. A young child may only be aware that something has been missed and may be unable to recognize or explain that he or she is having one or more blackouts for small periods of time. For the child having an absence or petit mal seizure, this is how it may appear.
Aaron, would you read the next paragraph, please?
The zookeeper explained, sometimes tigers don't have to do any tricks. They just eat the raw meat.
Very good. Boys and girls, notice the quote marks where someone's talking. Kathy, would you go on the next paragraph, please?
Epileptic seizures occur because of excessive electrical discharges in the brain. An electroencephalogram, a process of recording brain waves, is one of the major tools the physician can use for diagnosis. Once epilepsy has been diagnosed, medication can be prescribed to control a majority of seizures.
I had no idea you were going through that experience. How's she doing now?
She's on daily medication. So, in the last few months, she's only had a few seizures. And the school has been a lot of help, too. Well, everyone there knows that she has epilepsy and a seizure may occur, so they make sure that she keeps up with the rest of the class. Then, if Kathy feels like she might have missed something, she has a friend next to her who can show her where they are in the work and help her catch up. It's a lot different for everyone when you know what's happening.
Sometimes no one can know what's happening because everyone with epilepsy has a first seizure, and the first is likely to be an unsettling experience for everyone. Seizure looks like, but there are over 20 different types of seizures, many of them with unfamiliar characteristics. A complex partial seizure, like this, could be mistaken at first for some other condition, such as a mental breakdown or a drug problem. Most seizures have to run their course, and the main thing to do until it's over, or until medical help arrives, is to protect the person from injury.
No, not as far as
women, said they kind of looked up from their work and saw her stumbling around and kind of picking at her clothes and, mumbling, and that's when they came to get me.
Mary, you recall me this? Do you recall that you were stumbling around and saying real confused?
No.
Anything like this ever happened before?
No, there's nothing in here to indicate any kind of a special medical problem.
Do you know what day it is today?
December 20th.
Do you know where you are? You've been in an accident lately or hit your head or anything like that? No? Okay. Did you take any medications for anything? Maybe we should do that.
Yeah, she should be seen.
Okay, Mary, I think we're going to take you down to the hospital.
I don't want to go to the hospital.
Okay, Mary, I really think it's important that you go down and get examined. This has never happened to you before. We should find out what caused it. Okay, why don't you go down? Can you go down with us? Okay, why don't we go?
Leading a normal life means having the chance to work. For the person with epilepsy, holding a job requires the acceptance and support of both the employer and others in the person's working environment.
Now, Mary's coming back to work next week. She's been gone for medical leave for testing, and I guess they found she has epilepsy. Epilepsy. Mm-hmm. Now, you remember that seizure she had here a couple weeks ago? Yeah. All right, now they have that kind of thing under control. She's on medication, and we don't really expect that thing to happen again.
But what are we going to do if it does happen again?
Okay, it could happen again. Now, if it does, then this is kind of the thing I'd like to talk to you about. I think the most important thing is that we don't panic. So stay right at your job, and one of you go over to her and kind of just be with her, talk to her very quietly and stay with her. And then one of you come down and get me. And if I'm not in the office, get Mrs. Taylor. Now, we all know Mary's a good worker. And we've just run into a problem here. And I really think that if we work on it together, we can solve it. Okay?
Epilepsy. Millions of people have it. And living with this disorder will become a little easier as more people learn what epilepsy is all about and are able to provide the acceptance and support that people with epilepsy need to lead normal lives.
Okay. That gives you a view of at least what some seizures, or the three most common types of seizures, tend to look like. Each person's seizures tend to have a unique pattern. A couple more statistics about it is that one of the commonest ages, or 3/4 of the diagnosis for seizure disorder is before a person does reach age 18. So 1/4 of the time it is a situation like that third example where an adult suddenly begins to have seizures. There's a wide variety of causes for the problem. We try to encourage people not to call it a disease because it's a disorder. It's not something where there's an organism, a germ, or something that causes it. It's a dysfunction in the brain. And there is not really a cure for it. It's more like diabetes or high blood pressure. It's a condition that can be managed with medication. Surgery is also used sometimes these days, but medication is the most common treatment. Half the time, no specific cause can be found. Half the time, a cause such as a blow to the head or lack of oxygen when a person is being born, or from drowning, or from a toxic chemical, or an infection such as meningitis or encephalitis, an infection of the brain. Anything that may damage the brain, leave some scar tissue, and again, half the time no cause is found, And often people are saying, well, maybe it's when I fell down, or maybe it's when somebody hit me on the head. Usually a significant period of unconsciousness would be associated with any blow to the head that would cause this disorder later. Half the time, nobody can really decide what it was. That's one of the big things that bothers people. It's like, if I just knew why this happens. So the fact that it's unexplained is often a significant difficulty for the person. Are there any specific, quick questions about responding to seizures or handling seizures? Anything about the movie that you want to ask about?
I have a question.
Yeah.
When the gentleman was at the dinner table, if he was eating and had food in his mouth, they lowered him to the floor and he was flat on his back. Should they have turned him on his side at that point?
Probably if they tried to turn him on his side, he would have kind of rolled around. And that's a kind of a judgment call. It kind of depends on how much muscle movement, body movement there is with the seizure. If someone could be put on their side, if there's a soft, area to put them on and they're not moving around so much, probably putting them on their side immediately would be nice. They did wait until he stopped moving around before they turned him on his side, because he may have just banged around more if they tried to do it too early. So that kind of depends on what their situation is.
Is there anything to suggest that epilepsy might be hereditary?
Very, very little. In rare occasions, some families do seem to have a higher number of individuals that belong to that family who do have epilepsy, but it's not identified with any clear hereditary pattern, unlike diabetes, which often does run in families and has been identified as doing so. Research is being done in it, but it's unlikely.
I know up until 5 or 6 years ago, EEGs, like a third of proven epileptics, nothing was picked up on the EEG. It was just by visual observation.
By history.
Were given the diagnosis of epilepsy. Is there anything more proficient now, more accurate now?
MRI is being used a lot with
is
it.
That more?
It can show if there's a structural problem in the brain. If there's some scar tissue or something like that won't show up well in the CAT scan, the CT scan, because it's soft tissue. But again, I think the old statistic of half the time they cannot find a specific cause tends to hold up, even with something like the MRI, which means that often you cannot see the cause of the dysfunction. It's just there. And yes, it is true that a person who is diagnosed with epilepsy seems to respond properly to the medications for epilepsy, does not seem to have an unusual EEG. And there are people who, with an EEG, the brainwave test, show all kinds of abnormalities who may not seem to have seizures. So there's no direct connection there. Another one of the frustrations of diagnosing and determining what's going on. The supposition is that the leads of the EEG test you saw the little girl taking, okay, those are only on the scalp, and the brain is several inches thick. Another medical person, I can't tell you how thick it is, but it's several inches thick, and there may be activity that's occurring so deep in the brain that it doesn't get picked up with those surface electrodes that are even outside on the scalp. In hospitals, sometimes they will do what they call depth electrodes, where they have to do surgery to insert wires to check for electrical activity that's deeper within the brain. But obviously, that's something that's very serious. It's only done when there's considerable problems in controlling the seizures.
And the surgery would still be a last resort, isn't it? Because isn't it?
Oh, yeah.
It either cures the epilepsy or you're basically a vegetable.
No. The surgery is many times surgery to control the seizures is many times very effective. But there are always risks attended with surgery. Generalized seizure, brain surgery, is obviously a very serious matter to be undertaken. Only when the seizures cannot be controlled by medications. Well, there's a lot of testing that's done. The depth electrodes is usually preliminary testing looking as to whether surgery could be done to control the seizures. So to map out exactly which parts of the brain the seizures are beginning at, and whether those parts could be removed without causing other kinds of problems. Okay.
A couple of medical points here, Dr. Taylor, about what surgery might do and why maybe somebody should go to the hospital because they've had a seizure. And one of the reasons is that the seizure may not be the cause of epilepsy per se in terms of electrical disturbance in the brain. It may be a result of something else going on. It may be a space-occupying lesion in the brain, like a tumor, like a blood vessel, an aneurysm that has gotten large in size. And surgery sometimes for those problems is then a curative kind of situation because you're removing whatever it is that's pushing on the brain that's creating electrical disturbance that results in a seizure. Another common cause of seizures are blood flow problems. If someone, particularly an elderly person, is experiencing a clot that travels, say, from the heart through the blood vessels to the brain, and that obstructs blood flow to a part of the brain, that may cause a seizure. And then people want to know, well, can we maybe prevent someone from having another seizure, from throwing another clot by putting that person on a blood thinner? So that's one of the reasons that it's important, particularly for a first seizure, to be thoroughly worked up to determine what is the cause of it, that it's not just, it's an electrical disturbance and we're going to just control it with medication, but is there some medication to suppress electrical disturbance, but is there a need to do something else medically? And there are many, many possible things that can happen. And another cause of a seizure can be a more direct loss of blood flow if someone has, say, even a cardiac arrhythmia, which is not terribly unusual, and it can happen either in an elderly person because of something going on in the heart. It can happen because of an electrical shock. An attorney in town that called me one time and said, well, the guy got a shock from a refrigerator. Could he have had an electroconvulsive therapy treatment? And I said, really, no. That's not providing the kind of beneficial seizure to the brain, because seizures sometimes can be beneficial. You know that we use them here in this hospital for that purpose. But in fact, what happened probably was that the electricity threw his heart into a fibrillation and stopped pumping blood. He therefore stopped oxygenating his brain, and he therefore had a seizure. And then the seizure was probably by causing that excess physical activity and falling on the floor was like a kickstart to his heart, and got his heart started again. He woke up and said, gee, what happened to me? There can be a lot of different causes for seizures, and that's why they should be worked up. And sometimes in that kind of a situation, there may never be another seizure again because the cause of it was something that was limited and won't happen again as long as he gets his refrigerator fixed. It's sort of an unusual situation, but I mention it because sometimes unusual things happen and you have to be a bit of a detective as a physician trying to figure out what's going on.
Thank you. Yeah, very definitely. What we're dealing with is epilepsy, which is recurring seizures, and they're not provoked by something like an electric shock. As I mentioned, an infection like meningitis or encephalitis may start a person having seizures. Obviously, they have to have that infection dealt with. Afterwards, there may be some results, some residual effects of that infection, some scar tissue on the brain that may cause epilepsy. But whatever started the first seizure very definitely has to be looked into. And any adult, as you saw the woman in the factory situation, ought to be taken to a hospital and gotten a thorough check over as to what's going on. Do they have a tumor? Do they have an infection? Is there something else going on? There's some other, I guess, some metabolic illnesses also that may cause some seizure activity. So we wouldn't call that epilepsy. We call those seizures secondary to something else that's going on. They may have epilepsy later on with whatever that original condition was has been dealt with.
Do they have PRNs that will control, like the grand mal or whatever, during the seizure? Are there PRN medications that can be used?
When a person is taken to an emergency room, my understanding is that they commonly give a person Valium. That's the most commonly used medication that would be given right away. Medication for seizures is not the kind of thing that you give it when you feel a seizure coming on. It's quite the opposite. A person ought to have a therapeutic level of medication.
But is Valium, per se, is it effective in controlling the seizure?
You're getting into medical things. Back to Dr. Taylor.
I happened to be on a coast-to-coast airline flight one time, and the stewardess came on the PA system and said, if there's a doctor on the plane, would you put your call light on? So I said, oh boy, here we go. And I pulled my call light on, being dutiful. And the stewardess came down and said, could you come assist us up here? And I walked up about 5 rows. And there was a little lady sitting next to a man like the guy in the restaurant pouring orange juice down his throat. So my first job was to save this man aspiration pneumonia and say, lady, please stop pouring the orange juice down his throat. Well, her experience was that she had a diabetic in her family, and they had seizures, which were from insulin overreaction perhaps or whatever, and the lowering of the body glucose, so she was going to fix his glucose. And I mean, it could have been, but while he's in the middle of seizing, unless you can give it intravenously, you're not going to do a whole lot of good trying to pour it down his throat and get it in his lungs and everything else. So I managed to stop that from happening. But I mean, she was trying, you know, and the stewardess said to me, was there anything you'd like? And I said, well, and do we need to turn the plane around and land, you know, at the nearest airport? I mean, gee, that's a lot of responsibility. And I said, well, probably not. And he didn't have any ID on, unfortunately, that gave us any clue. But I said, you know, if he were going to have another seizure, I might like some Valium. And she reached into her pocket, and 5 other people who were looking on reached into their pocket for the Valium. You know, it's great, you know. But that's not the way they give Valium in the hospital if they're going to try to control a seizure. And if someone has seizures, which they were asking in this film that you saw, does he ever have another one back to back? They were trying to, you know, see, do we need to be ready for another one and get him to the hospital right away if they're hard to control. Sometimes they will use Valium, but they use it intravenously, directly into the vein. And that, as a sedative, or phenobarbital in the days before Valium, would help to immediately lower the brain activity and help to control a repeat seizure from occurring. And I guess the most common instance when that is used in a hospital setting is in delirium tremens, which is the most common medical condition in terms of alcohol withdrawal, where someone would have recurrent and repeated seizures that would just keep going on and on and on. Normally a seizure is self-limiting and it stops because during the seizure process the muscles are all tense and the person literally stops breathing because they can't have coordinated breathing activity. And as the CO2 level builds up in the brain, that helps to stop the brain activity, and the seizure is usually self-limiting. We think for that reason. At least that's what I was taught a few years back. Maybe they know something new since I've been through medical school. But one of the most common causes of a seizure that might occur to our patients here, if I can go on a little bit more for our own specific staff, would be one induced by medications that we give to the patient for beneficial effects. And most of the antidepressant and antipsychotic medications that we give cause the brain's normal threshold for a seizure to be lowered and can cause a person to have a seizure for no other reason than the fact that they've been on medication. And so here, in addition to the first aid things that you saw in the movie and alerting your nursing supervisor, the doctor for that patient or the doctor on call would be called, and the doctor here would make a decision based upon the person's medical history and everything else, whether we wanted to send the person to a general hospital immediately for evaluation, or whether we felt that we could just simply watch what's happening here and adjust their medication and begin a process of workup for epilepsy, which may take a period of over a week. They don't necessarily need to leave our hospital immediately to go to a general hospital emergency room, unless we feel that something else medically, like I mentioned before, like possibly a heart attack or something else, has perhaps precipitated the seizure.
Dr. Quill, how frequently does this excitement contribute to onset of seizures, like in a child?
I'm out of my league there, Ann.
What would it do? Pump adrenaline and then the brain would receive some?
I can't tell you that excitement either has any effect or no effect. I'm not aware of that. The most common thing that people are concerned about...
Every time you took him outside, he got so excited he had a seizure. So you took him back indoors.
Yeah.
This went on. Well, he loved going outdoors. And,
there are even what's called a psychogenic seizure, and there are hysterical seizures. There are all kinds of things that may be different, that may not have an electrical basis in terms of a discharge. And, you know, whether that's one or whether, in fact, there's some
connection between that in this individual, I don't know. But the most common stimulus for seizures was the one that we saw in the film during the preparation for the EEG or the brainwave, and that was the flashing light. And that is a known cause of a problem, and flashing lights will sometimes provoke seizures, and that's why they use it. It can be any light. It can be a fluorescent light fixture with its flickering. It can be driving down the street in a car and having sunlight come in between the trees. It can be going to a disco and having them use a strobe light like they use in terms of testing. And that does tend to stimulate the brain through the eyes in a repetitive pattern that tends to provoke this unwanted electrical activity. That's the most common cause as a stimulus, but I can't tell you, there may be documented cases as you're talking about. I'm just not familiar enough because it's not the kind of thing I do all the time. We could ask Rick Taylor, our consultant neurologist. He would know a lot more about it. Maybe other questions for Ms. Yalov?
With regard to the question about what may cause a seizure, we find that different individuals, in trying to determine that for themselves, do come up with a variety of possible triggers. One of the things that I have been most struck with in the time that I've worked for the agency is how unique each situation is in terms of when they started to have the seizures, what the type of seizure is, what it looks like, how long it lasts, what is likely to bring it on, how a person feels afterwards, how they feel about themselves having the seizures, whether they have any other problems that may be associated with this, perhaps what causes the seizures themselves. The seizures are more of a symptom than a thing in themselves. There's something wrong with the way the person's brain works at some times, so they have seizures. Whatever is causing that problem may also cause something like a learning disability. A person may have cerebral palsy. They may have retardation, or maybe some other kinds of symptoms of brain problems in the person who also has seizures. The seizure didn't cause the other problems. Whatever caused the seizures also caused the learning disability or whatever it is. Some people do find that they're more likely to have a seizure if they're emotionally very upset, and maybe it has something to do with adrenaline or some other kinds of chemicals, who knows. Some people find if they haven't had enough sleep, if they're very overtired, the flashing lights. And the flashing or flickering, some people think may even be involved with watching TV or sitting and playing with a computer or one of those video games that does a lot of flashing. So there's quite a range. There's quite a range in the capacities of the individual, whether they have other problems or not, and how it's affected them. How much a person identifies with this condition. Some people come into our agency and they say, I'm an epileptic. And whatever you try to get them to do, they will say, well, I don't know, I can't do that because I'm an epileptic. That person sort of over-identified with a medical condition that they have, and it's kind of made it their whole identity. And it really can kind of severely limit a person's abilities to use their other capacities in life. On the other hand, there are the people who say, oh, well, I had a few seizures, but I don't have to worry about it. They stop taking their medication, they miss the doctor appointments, they go the complete other extreme to denial of the fact that this is a medical condition that needs treatment, it needs monitoring, that you shouldn't stop taking the medications or even decide to take one fewer pill every day unless the doctor approves of those kinds of actions. So there's quite a range in people's reactions to how much they take it seriously, that they do have something that they need to take into account in their life decisions. Some people, still want to do something like get into construction and be up on scaffolding and working with dangerous equipment or something, even though their seizures are not controlled. That's the extreme of the denial. And other people refuse to go out alone, refuse to stay home alone, are very frightened to do ordinary everyday things because they're afraid they're going to have a seizure. So you see those kinds of effects. with regard to some developmental kinds of aspects or some psychosocial kinds of aspects. The age at which the person began to have the seizures, what kind of developmental stage they were at, whether they were 3 years old and they don't remember not having seizures, whether they were just starting into adolescence. We find a number of people seem to start having seizures at the time of puberty. And they're at that very delicate self-conscious stage, or whether they're an adult and they already had a formed self-identity and this doesn't fit and they have difficulty adjusting to that. The severity of their seizures, how frequent they are, what type they are. I had one person talking about the fact that when she was a child, she would have the grand mal, the tonic-clonic seizure, which she was totally unconscious. When she woke up, it was an hour or two later, and she felt sore, but everything was over, and they had been taken care of and put somewhere to rest, and didn't have to deal with anybody's reactions. Later in life, she started having that last type of seizure in the movie, the complex partial seizure. And she was partially, the woman in the movie said no, she didn't remember anything going on. Some people during that type of seizure have varying degrees of consciousness. And afterwards, they're aware of some of what happened, either very clearly or in a very confused kind of way. Those people often have much more difficulty with their seizures because they're half aware of what's going on. They know they're not in complete control of themselves. They are half aware of reactions from people around them. When they come out of the seizure, people are looking at them strange or have grabbed them or are yelling at them or something like that. And it's a lot more for them to deal with. The degree of control, whether they're able to identify a seizure trigger and then avoid it and therefore help to control their seizures, or whether even though they take the medication faithfully, the doctor keeps saying, well, are you taking these pills? Your seizures aren't controlled. Maybe they're doing everything they can think of to cooperate with medical treatment and the seizures are still not controlled. That leads to a tremendous amount of frustration, as you can imagine. How much impact do the seizures have on a person's daily life routines? How many times a day do they have to take medication? How many pills do they have to take? How many times do they have to go and check with neurologists and specialized neurologists who specialize in epilepsy? And how many medical centers have they been to? And has surgery been suggested? Did the seizure start as a result of something else, like a car accident that also left them with several other injuries, bodily injuries? Are they an adult who's been used to getting around on their own, driving, being very independent? Suddenly they cannot drive. They are dependent on other family members. They can't get out and do the things that they used to do before. That impact on their life, they're really going to notice. And are there, as I said, any associated disabilities, cognitive speech disabilities, motor problems, emotional problems? And then what was the reaction of their family? Was the family supportive? Were they overwhelmed? Were they over-involved? Did they reject the person? Some individuals feel that their families accuse them of not taking the medication or doing the wrong thing. Now, I told you not to go out, or I told you not to stay up too late. Now you've had another seizure. And does the family punish the person for having the seizures? Is the family terrified by the seizure? Do they worry about the person, follow them around, go and check on them in the middle of the night, won't let them go out on their own? You know, the reaction of the family and the people around them. If they have a job, what if their supervisors' reactions, their co-workers' reactions? Do people suddenly start avoiding them like they have something catchable? You know, is it AIDS? Is it leprosy? Is it some kind of social problem? Can I catch it? So the kind of environment, the response of the environment and the significant others to the person's problems. The aspects of the seizures themselves that really get to people are the unpredictability. It could happen anytime, anywhere. That interferes with their consistency, their experience of life, and their sense of competence and independence and security in life. Their dependency on others. If this happens as a child, their development of independence and autonomy through their developmental stages, and the interference with the already achieved autonomy of an adult. The side effects of the medication may have, typically people complain about feeling dragged out, feeling sleepy, feeling tired all the time. Sometimes it may actually affect their motor coordination and other kinds of, whatever, individual kinds of side effects. Sometimes people complain about weight gain. Typically, some of the medications may irritate the stomach. And sometimes one medication in particular, Dilantin, may affect the gums, may affect someone's appearance. And they're feeling that they're vulnerable in a way that they weren't before. The time and expense involved in their treatment. A lot of guilt and blame can get drug into the situation here. There's the why me kind of reaction. There's, as I said, the family blaming the person for having the seizure, the person blaming themselves for having a seizure. And there's just general restriction of activities and feelings. And if it's thought that a person may be more likely to have a seizure, when they're excited, does that mean that they therefore avoid normal activities, normal enjoyment, going out and participating in activities? Because they're always afraid of having a seizure. So those are some of the primary kinds of difficulties that may come with the seizure disorder in terms of relationship with itself and others in society. Questions about that? Okay, you probably run over your time.
I'd like to ask a question.
Yeah.
Don't we have support groups for people with seizures?
Funny you should ask. Okay, what I brought with me is our agency brochure, which does list our services. Support groups, we run a support group in Columbia and one in Baltimore for adults, either the individual themselves who has seizures or any interested members, a spouse, a neighbor, a family member, whomever. We have vocational services if there's difficulty with choosing a job or maintaining a job because of seizures in the workplace. And we have just general assistance with getting generic services in the community that a person may need that may be connected with the epilepsy. So our services are free to any citizens of Maryland. And our only requirements are that someone is willing to have us contact their doctor to verify that in fact they have epilepsy, basically. And then they have to sit down and answer all kinds of questions about what their seizures are like and fill out our paperwork. But yes, we're very happy to have people involved in support groups. I run a support group for parents of children under 12 who have seizures. We would love to have a support group for adolescents. We've never gotten, enough numbers of adolescents who are willing to participate for us to do that. And we do have the adult support group as well. We will go out to employers and educate them about seizures. If they are concerned about an employee that they have, we'll go out to any community group as well.
So if we had a patient who had difficulty with employment, we could contact you for support from the family and also.
I'd be happy to. My title is Individual and Family Counselor, and I'm available. I'm a licensed social worker to meet with people who are dealing with adjustment to their seizures in their life. Who wants to come in and meet with me or have things explained to their family. Sometimes people bring their whole family in and we pass out brochures and we talk about these kinds of things, and sometimes we even show them the movie. Whatever we can do to assist people in their
Driving a car, could you just touch on that a little bit?
The driving law in Maryland is that a person must be seizure-free for 90 days, 3 months, in order to have driving privileges. The individual themselves is required by law to report their seizure difficulty to the Motor Vehicle Administration. Doctors are not required to report. Anyone may report, I guess, but no one is required to except the individual themselves. There's a medical advisory board which requires reports from the physician as to the degree of seizure control that the individual has. So the law in Maryland is pretty enlightened in terms of the seizure-free period which is required. Other questions? Okay, I have an agency brochure. I'd be very happy for everyone to have one of these. I have a brochure called Seizure Recognition and First Aid, thank you, I'm sorry, which has a chart inside